Hello, today's interesting topic is prone position and what is the logic behind prone position. Welcome to Logic Medico, where we are understanding the concepts in medicine. So what are this supine and prone position? First let's understand what is supine position. Whenever a person rests on his back with the face facing skywards, that is called as supine position. He lies flat on his back and the face facing upwards or skywards. Next, coming to the prone position, when the person lies on his tummy or the belly, the face downwards or to the right or left side, this is called as prone position, where the back is facing skywards. So before going into the details of this prone position, let's understand the basics in the human body. The human body, as such, upper part of the human body contains thorax, that area is called thorax. Lower part of the human body is called as abdomen, in which many organs will be there. Here also organs will be there. Separating the two, there is a muscular partition which is dome shape. Two domes are there, right and left dome. This muscular partition is called as a diaphragm. So let us see what is there in this upper part of the body called as thorax and this lower part of the body called as abdomen. So in the thorax, we can here see there is one hemiconical structure, that is right lung on the right side of your chest, and obviously on the left side of the chest, left lung. Between the two lungs, in the middle, the area is called mediastinum, where the heart is situated with the four chambers. So this is the heart. This is the muscular partition called the diaphragm, beneath which liver, spleen, stomach, small intestine, large intestine, kidney, ureter, everything, all the organs will be placed in the abdomen. So this is the diaphragm partitioning the thorax from the abdomen. So there are 300 million alveoli in each lung. We have two lungs, right and the left lung, each one hemiconical in shape. Within each lung there are 300 million alveoli present. Okay, with most of it is reserved. We are using only 1/3 of it during normal respiration. So what is this alveoli? We will understand. It appears like a bunch of grapes. Just delete the inner portion of the grapes. Here there is a cavity through which air will come when you are breathing in through the nose. Air will enter this alveolar duct. They will enter through various passages. Ultimately comes to alveolar duct. Here one pouch is there called the alveolar pouch or the alveolar sac. Each one is called as an alveoli. Each sac like this is the each balloon-like structure, grape-like structure is called as alveoli. Air will come into this alveolar sac. Surrounding this alveolar sac, there are capillaries. These are blood capillaries. So they are present in lung. We call it as pulmonary capillaries. Obviously, what will come into that? Blood will fill the capillary. This blood is rich in deoxygenated blood or carbon dioxide rich blood. So CO2 will be abundant here. So here O2 will be abundant. O2 is oxygen. So oxygen will diffuse into the capillaries, while from the pulmonary capillaries CO2 will diffuse into the alveoli. That is the exchange of gases which takes place between the alveoli and the pulmonary capillary. So blood will fill up the capillary which carries carbon dioxide, and air will fill up the alveoli which carries oxygen. So there is exchange of oxygen for CO2 between the alveoli and the capillaries. So here, in case of COVID-19 or any infection, viral, bacterial or fungal infection affecting the lung causing pneumonia, initially the capillaries and the alveolar epithelium will be damaged. Fluid starts leaking, the plasma starts leaking and fill up this interstitial space. Subsequently, the fluid also fills up the alveolar sac like this. This comes out as a phlegm or the sputum. Now what happens? The person has got cough with phlegm with sputum because of excessive leakage of capillaries. So what happens ultimately because of this? The fluid inside the alveoli or the interstitial space prevents the exchange of gases between the alveoli and the capillary. So that is the main cause for reduction in the saturation, the oxygen saturation. So exchange of gases is prevented, therefore In pulse oximetry, when you measure, you can see one of my video, pulse oximetry, how to measure pulse oximetry. In that, the saturation drops because failure of exchange of CO2 and O2. O2 has to be taken in and CO2 should be given out. So in pulse oximetry, you can measure the initial value is oxygen saturation, the subsequent value is your pulse rate. Therefore, the saturation of O2 falls here. So below 94, if it drops, you have to do prone ventilation. That I will teach you in detail. So what are the factors preventing the exchange of gases? Let's understand what prevents the exchange of gases first up. So here is a person lying in supine position. Here is his lung. So something drags his lung downwards. Here majority of the alveoli are present at this level. So that something which drags the lung down is the gravity. Because of the gravity, majority of the lung tissue is being compressed here against the back. Okay. So here like this abundant amount of alveoli are being compressed against your back in your supine position. So gravity is a major role, plays a very major role in compressing the alveoli in supine position. During normal individual can lie supine position. You may argue how, because we have excessive amount of reserve amount of alveoli, 300 million alveoli. Even if it is compressed, the normal alveoli will function to perform exchange of gases. So gravity is a major cause which compresses the majority of the alveoli in an infected person, especially COVID-19. So alveoli are compressed. In addition to alveoli, so because we are lying in supine position, the more amount of blood will flow into this area. So when more amount of blood goes to this area, but the alveoli are not ventilated. Why? It's been compressed. So to the compressed alveoli, more blood is flowing. So there is no point in this. This results in pulmonary capillary mismatch, where the capillary blood flow is increased in this area, but the alveolar ventilation or the oxygen coming to this alveoli are reduced. So this worsens the pulmonary capillary mismatch. In addition to that, the fluid, interstitial fluid, which has leaked out into the alveoli as the alveolar fluid, which now comes out as the obstacle between the oxygen which is inhaled by the patient and the capillaries filled with blood here. So the phlegm also, the phlegm or the sputum or the viscous liquid also interferes with exchange of gases here. So this is a second major factor. Therefore, clearing the coughing and spitting out the phlegm improves the person's breathing ability, or they feel relieved. Now, which are the organs which compresses the lung? That is a third factor. Organs which can compress the lungs. Let's understand this. So here you already know this is a right lung and that's a left lung and this is a heart in between and this is a diaphragm. Heart is retrosternal, though we tell it is midline. It's slightly levo-rotated, means it's twisted to the left. So you can clearly see the left lung in normal position also it's been compressed by the heart. So heart is the first obstacle which is compressing on the left lung. We can better visualize this rather than seeing from front on view. If you see in supine position, it will clearly make out. See how our heart is compressing on our left lung. This is viewed from left side of the patients here. In supine position, the heart is pressing upon our lungs, clearly visualized. So the alveoli are being compressed by our own organ called heart. So the left lung is compressed by the heart. Why? Because heart is levo-rotated. Viewed from left side, if the person goes to prone position, and if you see from left side, when he is in prone position, you can clearly see the compression on the lung. Previously it was compressed so much. See here, so narrowed. Now the lung has got sense of relief. See, it is expanded. So the heart is not pressing upon the lung now because it's in prone position. So that's a logic behind it. So the left lung escape the compression of the heart. So more alveoli have been spared now for ventilation. So the persons feel relieved because more alveoli are now been available for exchange of gases. The second organ which will compress the lung is liver. So liver is a wedge-shaped organ. It's infradiaphragmatic on the right side of the abdomen, upper portion of the abdomen. This liver is the largest organ in the body, 1.5 kilo. This is a gallbladder which collects the bile. this lever compresses the lung. Sir, how I can't see that here? Yeah, of course, in the front on view you will not be able to see. So through the diaphragm, it pushes the diaphragm up and compresses this. We'll see that in the side on view. See, this is viewed from the right side. I already told you this is present in the right hypochondrium or the right side of your abdomen. Okay, so here is the right lung. This is a supine position. You can clearly see, because the diaphragm is dome shaped, the upper convex surface of the liver is compressing upon your lower edge of the lung. Actually, majority of the alveoli in the initial slides I showed you are present in this lower lobe. So this majority of these alveoli are being compressed by the liver in which position? Supine position. So liver is compressing upon the right lung mainly. So what happens when you shift to the prone position? You can clearly see the compression is relieved now, because liver falls forward and the anterior edge of the lung is thin. Even if it compresses, it doesn't matter now. Majority of the alveoli are relieved of the compression. They breathe a sense of relief. So they are opened up and exchange of gases takes place here in prone position. So supine position is a position in which the person rests on his back, he faces upwards or skywards. In this position, the following factors interfere with gaseous exchange. Number one, gravity. So this gravity drags the lung downwards. Okay. So blood flow also downwards, and compression also. If the fluid is there in the lung, that also phlegm, that also drags downwards. And the alveoli are blocked there, but the blood flow is there only. So there is no exchange of gases there. So gravity is one factor, phlegm is a second factor. Third factor is the heart. We saw that it was compressing on the left lung because of levo-rotation of the lung. So fourth one is liver, it was compressing on the right lung. So this is a summary of what are the structures which are interfering with ventilation or clear expansion of lung, because lung is a spongy tissue. So sponge is being compressed by so many places. So in prone position, get relief from all these things. So proning is usually done for whom? When the SpO2, the saturation of oxygen, falls below 94, we have to advise proning for the individual. It's measured in pulse oximetry. You can see one video on pulse oximetry. So let's understand now what are the positions in proning and why this kind of pillows are placed over there. So this is the first position. Each position you have to maintain for 30 minutes, and you have to rotate this position. Three main positions I will tell you. So position number one is the prone position. It's a major position in which the first pillow, this is a prone position, the first pillow has to be placed below the neck, the second pillow below the pelvis, and the third pillow below the foot or the feet. So this first pillow below the neck, so that the windpipe or the trachea is kept in without getting kinked or bent. It will be straight, so better ventilation will be. Second pillow below the pelvis, so that venous return happens. Here also, this pillow below the feet also to act as a cushion for the toes. Otherwise toes will hurt, right? Also to help in venous return. So when venous return happens, more amount of blood reaches the heart, more amount of blood from the heart reaches the lung. So better ventilation. More amount of air will enter here, so it should be below the body level. So more air will enter through the straight pipe called windpipe or the trachea. It will go down. More air is coming, more blood is coming back to the heart and finally into the lungs. So better exchange of oxygen for carbon dioxide, so saturation improves. So 30 minutes you have to be in relaxed position. The face can be either to the left side like this or to the right side. In prone position should be maintained for 30 minutes. So there is a cycle. So 30 minutes position 1, next position 2, 30 minutes has to be maintained even in this position. Again 3 pillows are used. One of the pillow, this is lateral position. As you can see, the patient is facing you, so it's a right lateral position. Next 30 minutes you can turn to the left side, left lateral position. So this is a lateral position. Here in first pillow we can clearly see placed below the head, second pillow below the waist, here third pillow is between the legs. This is to avoid compression between the legs and uncomfortability. Here the waist allow free expansion of the abdomen, because as we breathe, abdomen has to expand, right? So free expansion. So this pillow stabilizes air windpipe or the trachea will be straighter. That is the logic. The previous slide, don't place the pillow below the abdomen, because when you breathe, the air will come into the lungs, it will push the diaphragm down, abdomen has to freely expand. So this is the second position, again 30 minutes, lateral position, right lateral or left lateral, 30 minutes you can in position 2. Last position is position 3. In this also 30 minutes. This is called the slanting position or the 45-degree inclination position. You can use pillows for resting the head, resting the back and resting the arm. You can use two pillows here to rest your arm comfortably, and one pillow here and one tiny pillow here. So rest the head, rest your back and rest your arms in a comfortable position, 45-degree angle. In this position also 30 minutes you have to maintain. Better ventilation happens here also. But the prone position is best for exchange of gases. So what are the contraindications of proning? Number 1, in pregnancy, the proning is contraindicated. Morbid obesity, the person is severely fat or obese, morbid. Any spine surgery, backbone surgeries, any spine injuries, deep vein thrombosis, if there is a clot in the veins, cardiopulmonary disease, disease of heart and lung, chronic diseases, increased intracranial pressure, because this will cause increased venous return, more pressure will rise inside the skull. Recent abdominal surgeries are also contraindication. Contraindication means these patients should not do proning. Kindly like and share this video with your family and friends. Thank you for watching and learning from Logic Medico. Subscribe to our channel if you have not yet done already, and don't forget to press the bell icon to get all the notifications which we upload. Thank you once again for learning from Logic Medico.